Hi, it's Dr. Parikh with ReGen Medical. Today I wanted to talk about foot pain, specifically bunions. There's a lot of folks that are out there dealing with pain from bunions. Patients often can't walk nearly as far as they want. They can't stand for nearly as long as they would like. So it really impacts a lot of their daily life. That will lead to other problems, knee problems, hip problems, back problems, because they aren't walking right. And majority of times bunions are treated, maybe a steroid injection. Certainly we're looking at potential inserts. But then what's the next step? Generally it's some sort of surgery. Well, what if you're higher risk? What if you don't want to have surgery? What are the options? Well, generally they're not very good. Your foot doctor may recommend some repeated steroid injections, which actually don't help the joint whatsoever. They'll make it worse in the long run. But what are some other options? It's called Prolotherapy. So basically what we're trying to do is we're actually trying to regenerate the tissue that has been damaged that is leading to your bunion. Now essentially what happens is that there are ligaments that connect this bone to this bone, and they'll start to fail. And then this big toe here will start to turn inside. And a lot of times you'll get some arthritis that's in here as well, and that's because it's loose over here. So by putting some prolotherapy solution into this area along these ligaments, along some ligaments here, we'll be able to stabilize that bunion and essentially stop it from getting worse and hopefully get your pain a whole lot better. So what happens with bunions is that the pull forces from the inside versus the outside of your toes are abnormal. The inside is pulling more than the outside, so it gets stretched, and the body responds by forming more bone in that area. And then suddenly you've got this big turned in toe with arthritis in that. Well, what if you're just starting to get that and you're like, well, what do I do? And the surgeon says, well, it's not bad enough to operate. Well, the great treatment is prolotherapy. We can regenerate some of the cartilage within the joint, but also really stabilize the ligaments on either side so that you're not progressively getting worse. So if this sounds like something you're interested in, something that would help to prevent that potential surgery, or even if you're not thinking of surgery, you're just impacted by your day-to-day pain, give me a call, give me an email. We can get you in, we can get you assessed and see if this is the right answer for you.